I'm excited to share with you all that I've contributed a chapter to the newly published Anxiety Relief Handbook. The handbook provides a unique window into 11 highly effective complementary therapies for you to sample on your quest to ease anxiety. The ebook is available on my website, happynurse.com.au/anxiety relief handbook.
There's a bit of a recipe, but what we're firstly looking for is where it is in your body. So actually really feeling into your body. So sometimes the easiest way to do that is to, just feel yourself sitting on the chair, feel your feet on the floor, take some slow breaths into your body and just tune in to your body.
Welcome to the Happy Nurse Podcast. Nurses are the backbone of healthcare, always there to care for strangers as if they were one of their own, often forsaking special moments with their own family in order to ensure another's loved one is being cared for. As nurses, self-care is essential. I am Elena Mullery, nurse educator and self-care mentor for nurses. I'm an RN with 20 years of clinical experience. I have first-hand experience of stress and burnout. It was this experience which led me to develop a passion for personal development and pursue the study of mindfulness, meditation, hypnotherapy, and neuro-linguistic programming. Each episode, I will be promoting self-care strategies to those who always care for others. I have broken self-care down into 5 aspects: mental, emotional, physical, spiritual, and indulgence, to make it easy to ensure all your self-care needs are being met. Each episode, I will interview nurses and self-care gurus from around the world to help you with each aspect of your self-care. Welcome to the Happy Nurse Podcast with Elena Mullery. Hi everyone, welcome to another episode of the Happy Nurse Podcast. Today I am joined by Lauren Bell. Lauren was the guest in episode 2 as well, if any of you have listened to that one. Lauren is a money mindset and inner game specialist. She's fiercely committed to coaching heart-centered professional women who are feeling exhausted, frustrated and undervalued to confidently and authentically start asking for what they want so they earn a great income and thrive in life or business doing the work that is their divine purpose to share. Lauren is always passionate about health and wellness. Her professional career includes over 30 years as an acute care registered nurse and a counsellor. She's combined this with a broad range of holistic therapies for the body, mind and spirit. Her qualifications include body talk practitioner, tapping into wealth coach, life and transformation coach, and emotional freedom technique, which is also known as tapping. Lauren has a private and group coaching clients who work on all aspects of health and wealth mindset. Hi, Lauren. Thanks for joining me again.
Yeah, great to be here. Thanks, Elena.
I have actually been part of Lauren's It Starts With Me program for the last few months. I believe self-care is about continuously exploring new ideas and digging deeper and seeing what's hidden in there that's keeping us held back and creating these triggers that we have in life. And I have found this method, this EFT method, so effective and so beneficial. I asked Lauren if she would come back on and do a little demonstration with us and share a bit more about the emotional freedom technique.
Yeah, wonderful.
We are recording this episode. It's going to go out as a video as well. So if we refer to anything that's in the video will be available in the show notes. And there'll also be some PDFs on the tapping points in there too. So, and those of you watching on the video, we'll put the PDF in the links below. If you enjoy meditating or you would like to give meditation a try, why not head on over to happynurse.com.au/meditation to download my free guided meditation for stress and anxiety relief. It's 12 minutes of pure self-care. I'll let Lauren share her screen.
Okay, great. All right, so we'll straight into it. So I wanted to talk a little bit about emotional freedom technique, which is also known as tapping or EFT. There's a few names. If you actually do a Google search, you will be inundated with how much information is actually available. But a lot of people haven't heard of it, and a lot have too. So we'll take you through it. It's actually a stress relief technique. It's really about a mind-body tool and healing. And it has a very formal definition, but the simplest way to think about it is that it's a unique exercise to calm you down so that you can think more clearly about the problem and do something different. So what we actually do is use a very light touch, tapping over acupuncture sites while we're speaking the words that are actually in our mind, what the things that we keep saying over and over. So it's about sort of drawing down and exploring what's going on for you and speaking that out. So it's a bit like combining some positive psychology as well as the tapping to reduce the stress in the body. And it's the combination that actually works. So they've shown this on MRIs and things like that. So there has actually been a lot of research, and a lot of it's being led by Dr. Peter Stapleton, who's a psychologist in Queensland, Australia, from Bond University, and she's done a lot of research on EFT for food cravings and weight loss. But overall, it has been researched by more than 10 countries with over 60 investigators. And this is probably a little bit old now, but it's been in a lot of peer-reviewed journals as well, greater than 100 publications. They've shown it to have really effective results on PTSD, depression and anxiety, and they actually use it with returned soldiers. Particularly in America and in other countries, they've added it to their health regime. And I can really see a future in Australia, even as we'll go through a bit more. It's a great technique, but it's really great for self-care as well. So some of the things that we can use it for is anything that's really got an emotional basis. So really that's everything. So anything that you're feeling in your body. So stress, anxiety, depression, and things like trauma, memories, post-traumatic stress. You can also use it for wealth and abundance. And as Elena said, she's doing my program, which is all about wealth mindset. It's actually, we use the wealth and money, what's going on inside you, and how your relationship to money and how that affects your feelings and your thoughts and your body. And from doing that, we can actually access a whole lot of information and memories and things like that. So we're using money as a metaphor in that case to actually dig deeper. Can also be used for things like physical pain and acute and chronic pain. We have the case of John, which I love sharing, which John was involved in a car accident and broke his leg, and he went along to a seminar about EFT. It wasn't actually my seminar, it was someone else's. But in that seminar, he volunteered to be a demonstration, and he rated his pain at 9 out of 10. He'd been trying to have sort of lots of treatment and nothing really was working. And apparently the EFT practitioner was even a little bit concerned that this, maybe wasn't going to really work, because obviously he had a physical situation where he'd been in a car accident and had broken bones. But anyway, they did the tapping, and what came up for him was he was been driving his wife to somewhere where he really didn't want to go. So he was angry at her because she coerced him into going somewhere. He was angry at himself for not saying no. He was angry at the other driver that had caused the car accident. And while he was doing the tapping, it reminded him, brought up a memory of his mother being late to a party when he was a little boy to pick him up. And obviously he was quite distressed and upset about it at the time. So once he released all of these aspects, doing the tapping, he was then able to rate his pain as 2 out of 10. So the physiological pain was 2, and the rest of it, the other 7 points when he started at 9, were all the emotional factors that were involved. And if you think about anything, there's always emotional factors. We just don't tend to spell them out so much. But you think of someone having an operation and they might be concerned about their income or their family at home or their diagnosis, or there's so many aspects that we're always dealing with.
I found this fascinating, especially around the money mindset, because I didn't realise a lot of the grief that I have from what happened in my early adult life has been associated with my money, and I've been pushing the money away due to this grief, and it's been absolutely fascinating uncovering all this. And since I have, guess what? I'm making more money. It's so cool.
That's the beautiful thing. I love it because it helps you on all levels, like just to be able to ask for what you want. But actually what is happening is you're suddenly able to receive more, and you're also able to see opportunities that you previously were closed-minded to. So yeah, it's fascinating. So that's one of the benefits, is that we actually increase our earnings or opportunities, ways to actually receive money and be able to keep it too.
Yeah, definitely.
Wonderful. And yeah, so it can also be used for illness, for insomnia, have a great tapping script and method to actually really be able to get to the bottom of what's stopping you from sleeping. And often it's just that we've got so much on our mind that we feel our mind really feels like it just can't let go. So once we do the tapping and calm all of that emotional charge down as well, people end up reporting beautiful sleeps, even when they've tried lots and lots of things. I've worked with solicitors and other people in really high-powered, mind positions that have been able to really sort out their insomnia. As I mentioned, Dr. Peter Stapleton has done lots of work on food cravings, addictions, weight loss, so all of those things as well. Things like your body shape, and it really is about learning to accept yourself, how you see yourself, how you love and accept and give kindness and compassion to yourself. So it's just a really, really opening up way to make life a lot more pleasurable. It can be used for sports, performance, things like even exams or public speaking, or anywhere where you want to be performance and that you might have a bit of anxiety around it. I've also worked with someone who was sitting some fairly high piano exams, and the difference for her was amazing because, like most of us, when she was in an exam beforehand, if she was really stressed, we can't think. That basically we go into fight and flight mode, and the blood is just not going to the higher cortical centres. It's actually more in the fight and flight, the limbic brain. And so doing the tapping, calming down the nervous system, reducing those memories of what had happened in the past, she was then able to go into exams with just a whole lot more positivity, but also she found that she was able to practice with more joy. Like she was just able to enjoy all of it. And so, yeah, she was really thrilled with her responses and did really well in future exams. And the other thing, as I mentioned, it's really great for self-care, is because you can do it in the moment when you're actually might be struggling with something, or later on when you look back at that thing. So sometimes when we're at work, there's stuff going on that you probably can't do the tapping for. But if you look back at it later that day, and you can still get just as emotionally upset about something. If someone said something to you that upset you, you can replay that whole conversation and feel the same emotions, and you can actually do the work to reduce that all there. So it can be used now or in the past, and that's what we also do. We clear out. That's how traumas and things like that are actually removed.
It's very cool.
So there's a bit of a recipe, and I'm going to explain this a little bit, but what we're firstly looking for is where it is in your body. So actually really feeling into your body. So sometimes the easiest way to do that is to, just feel yourself sitting on the chair, feel your feet on the floor, take some slow breaths into your body and just tune in to your body, because the truth is a lot of the time we're actually up in our heads. We're not even aware that we have this body that we're just it's like going through the motions. So tuning in firstly to your body. And if you're thinking about something that is upsetting you, you're going to rate that distress level. We call it a SUDS, which is actually I can't remember. It's just stress level anyway, and it's like a pain scale, which basically is 0 is nothing and 10 is maximum. So if the distress was really high, it would be up towards the 10s or maybe 10, and if there was nothing, it would be 0. And so we're always aiming to bring that SUDS level down from the high levels down to at least a 2, even 1 and 0. We do a little setup. So it's even though I have this problem, and we name the problem, and we're going to go through a tapping that I actually did at Elena's last year, which was on self-care.
So I found the tapping really beneficial after a long day, particularly if I've been really busy. I've had a stressful shift. We all know what it's like to have those days as nurses. Some days you don't get breaks. I know I've spoke about this many times and you'll all be thinking, oh my God, she only speaks about going to the loo. But I can go a whole shift without even going to the bathroom because I don't drink enough water. Like, the stress that this is putting on our bodies is huge. And if we have some kind of technique to release that stress that's being built up in us during the day when we get home, or even throughout the day if we do get that few minutes, just to tap it out and to clear that energy that's stuck in us, that stressful energy, and keeping us in that fight or flight, it's incredibly beneficial to us and our bodies.
Because I know, as you said, we don't, as nurses, we often don't take our breaks. We often work over the time we're meant to be. We work longer shifts than we're really supposed to be. There's a lot of factors. People are already in a stressful environment, don't always speak nicely to each other. So there's things that go on that we're always constantly dealing with, and then we're always still giving. We're giving and giving and giving to our patients and, you know, even sometimes to our colleagues as well. But the thing is, we're forgetting to look after ourselves.
Yeah, totally. And we come home and we continue to give if we have families or husbands or partners. And this is a tool I found really good for giving back to me and making sure I am filling my cup, as the metaphor goes.
Yeah, absolutely. So I'd love to do a demonstration and talk you through what we're doing with EFT and how to do it. And what I'm going to get everyone to do is to tune into that bit where we're overgiving, we're just doing it for everyone else, we're not putting any of our own needs first. And so I'll take you through that in a minute, but I'll just give a little bit of an explanation of how to do it. So
awesome, thank you.
The first thing we want to do is just to notice, where are we feeling it in our body? And the truth is, we often don't feel our feelings. We're often up in our head. It can be a little bit of a protective mechanism, because if we get overwhelmed by our feelings, well, then we can't really operate. However, if they stay there, not ever being expressed, then they just become ripe for, you know, it's like not ever expressing your emotion, your anger, and then all of a sudden the volcano erupts. So tuning in, where in your body are you feeling it? So if you're thinking now about exhaustion or giving and giving to everyone else and then not really giving to yourself, just tune in and see how you really feel. Where do you feel it in your body? And I'd like you to determine, like on a pain scale, the distress level. Determine the distress level, the SUDS, which is basically like a pain scale. So 0 is 0 and 10 is maximum. So where on the scale are you when it comes to feeling this exhaustion, this depletion that you have in your body?
As an example, I know when I'm stressed, the first sign in my body is I start clenching my teeth, like my back teeth. And the more I'm clenching, the more stressed I am. So yeah, that's my trigger. And it's taken me a while to realize that, but it is knowing where in your body you're storing it. And I think that's key, because once you know it's there, you recognize it very quickly, and then you can take steps to actually do something about it.
Yeah, the truth is with this too, the more you do it, the more in tune you become to your feelings, your thoughts, and, you know, just you have that awareness. So, and when you're clenching your teeth, what's the emotion that's coming up for you usually?
It's usually when I'm stressed. So it's that frustration, that overwhelm. I'm hitting that overwhelm point, and that's when the teeth start to get clenched. Yeah, the jaw just tightens.
Yeah. So that's the next thing. So determine on a scale of 1 to 10, how strong it is. So what would you say that was for you, Elena?
Right now it's okay, but I know after a particularly busy day a couple of weeks ago, it was probably like 6 or 7.
Yeah.
But I actually did a session with you just by chance after that day, and it was hugely beneficial. So
yeah. So the idea is if you're not feeling it right at the moment, you can actually go back into the memory of it. So remembering that time, feeling it. So we'll set it all up as a proper session in a minute. The other thing we're going to be doing is we just start by tapping on the side of the hand. We call it the karate chop point. And during that state, that time, we're saying a setup, which is even though I have this problem, so in this case we're using exhaustion, overwhelm, I deeply and completely accept myself. There's a few of those statements that we can use. It can be I accept how I feel, or I honour my feelings, or the idea is too that I love and accept myself. Some people find that a bit hard, so it can be I intend to or I want to love and accept myself. So these are all set up statements that we use. Then we go through a tapping sequence, and then we're going to remeasure that emotional charge again. What's the distress level on the SUD scale? And we keep doing it, actually, another tapping until we can get that level down from the 10 or up high down to either 0 or 1 or 2. So the tapping points, top of the head, so just with gentle fingers, you can use one hand, both hands, and you just can tap in the midline of your head. And then the second point is the eyebrow point, which is the bone sort of around just above your eye, above your nose, but on the bone. So you're tapping there at the eyebrow point, and then at the side of the eye. So once again on the bone, then under the eye, then under the nose, under the chin, and then on the collarbone, so either side. And some people can do tap here on the hand, so it's this gamut point, it's called. So it's that little channel, and we may not do that today doing our demonstration, but you can always do it. And actually that's a great one if you're wanting to do a bit of tapping in a place where you don't want to be seen tapping through the other points. So it is possible to just continue to tap on that gamut point. And that's the sort of thing that I've done when I've been upset at work about something. I've just quickly tapped and sort of basically very silently thought the thoughts and tapped through on that point, and that can reduce the stress and the feelings in your body too.
Yeah, it's very subtle and nobody would know what you're doing unless you told them what you were doing.
Yeah, and then sometimes I just tap on my collarbone too, and yeah. Okay, so it is interesting. We speak the words that are actually coming up for us. So we state them as a negative. So, even though I'm feeling this stress or this emotion, and as we go through the tapping script, you might hear some of the words that sound negative. And one of the things to be aware of is that it doesn't actually affirm the problem. So some people really hate saying the truthful feelings. And in fact, that's part of the release, is that we're finally saying what's been going around and around in our mind. So we're just stating the truth and acknowledging it for what it is. And the tapping actually calms the physiological response. Once it's released, we do get a cognitive shift. So basically it's reframing the thought. There's also an aspect of linking to the hippocampus, and that's why memories can come back up for us. Like I talked to about John, who had that memory of his mother missing him at the party, being late for him at the party. And the other thing is, if we go positive too soon, so we do use this for positive as well, but if we go positive too soon when there's negative stuff there, it's a bit like, just putting deodorizer and not taking out the rubbish sort of thing. So it's only going to bring a very palliative or simple result and not really work.
How I interpret this, and correct me if I'm wrong, Lauren, is it's almost like we have to state the negative to take the fuse or the charge out of that negative thought that we're having, so that then we can turn it around and reframe it into something more positive. Would that be about right?
Yeah, so it's just stating what is really going on, and if we don't state it, it's still there basically. So yeah, it's stating it, saying it out loud, what's going on. And just hearing that sometimes, that's when we can start to think, oh my gosh, do I really think that? Is that true? Like, it shows us some of these really illogical beliefs and things that we have running that often contradict each other, because we often have ambiguous feelings, and there's aspects that we want about something, but there's also fears or other things that might be stopping us. So stating it all just helps it bring it to the light. And there is an aspect, it's to do with reducing the stress in the body and really tuning into the parasympathetic nervous system that then allows blood flow to the prefrontal cortex. And that is what also helps us to reframe. And so different thoughts will pop in and we'll start to even argue in our mind, oh no, that's not true, as we're tapping through, and that's all fine.
Awesome.
So we'll go through an experience of it. So what I want you to do now is just think, like we were talking about before, maybe a day at work or sometime where you've been really overgiving, and you may have ended up having to work back. You're just whatever's gone on. Maybe there's been a bit of a conflict or a difficult patient or a difficult situation, a sad situation, some sort of effect that it's had on you. And really you haven't been able to look after yourself. You've been so busy, and then there's still more to do. You might even have to get some shopping on the way home or cook dinner, or, just being with the family and wanting to give them you in a way that you love, to show them loving them, but really you've got nothing left. So I want you to tune into a time when you were feeling like that. And I want you to feel, where are you feeling it in your body? And if you can state what the emotion is, what state is it? What emotion is it? And also think about what thoughts come up for you. What's the self-talk? And I'm going to take you through a tapping script. Now, these words are actually words from many health professionals that have been in this burnt out, exhausted situation. So when I'm going through them, Elena's going to repeat them back after me, which is giving a experience for you as well. So as you go through it, just repeat the words with Elena. And you'll probably feel like some of these words are exactly your words that are coming in. Some might not be, and that's fine. And what we can do in that situation is just change it, tweak it slightly so that it has more resonance to you. So just tapping on the side of the hand. Even though I'm exhausted and not looking after myself or my self-care.
Even though I'm exhausted and not looking after myself or my self-care.
I choose to accept how I feel.
I choose to accept how I feel.
Even though I'm tired.
Even though I'm tired.
And I don't feel I can stop.
And I don't feel I can stop.
I accept myself deeply and completely.
I accept myself deeply and completely.
Even though I'm so tired.
Even though I'm so tired.
Nothing left to give.
Nothing left to give.
I accept how I feel.
I accept how I feel.
Now tapping through the points. So top of the head. I give and I give and I give.
I give and I give and I give.
Who gives to me? Eyebrow point.
Who gives to me?
Side of the eye. Pour me.
Pour me.
Under the eye. I'm empty inside.
I'm empty inside.
Under the nose. I'm so exhausted.
I'm so exhausted.
Under the chin. I've lost my passion.
I've lost my passion.
Collarbone. It all feels too much.
It all feels too much.
Under the arm. I can't take another thing.
I can't take another thing.
Top of the head. It all is too much.
It all is too much.
Eyebrows. It's all too hard.
It's all too hard.
Side of the eye. I'm disconnected.
I'm disconnected.
Under the eye. I have no energy.
I have no energy.
Under the nose. No energy for me.
No energy for me.
Under the chin. I'm ignoring what my body is telling me.
I'm ignoring what my body is telling me.
Collarbone. I soldier on.
I soldier on.
Under the arms. It's all up to me.
It's all up to me.
Top of the head. I feel guilty if I take time for me.
I feel guilty if I take time for me.
Eyebrow. It feels selfish.
It feels selfish.
Side of the eye. I'm just surviving day to day.
I'm just surviving day to day.
Feel overwhelmed. Under the eye.
I feel overwhelmed.
Under the nose. Exhausted.
Exhausted.
Chin. I'm so tired.
I'm so tired.
Collarbone. I'm doing everything, but I'm doing nothing well.
I'm doing everything, but I'm doing nothing well.
Under the arms. I'm trying my best, but I can't do it all.
I'm trying my best, but I can't do it all.
Top of the head. I'm stretched too thin.
I'm stretched too thin.
Eyebrows. Trying to please everybody.
Trying to please everybody.
Side of the eye. Nothing left for me.
Nothing left for me.
Under the eye. I was taught to put others first.
I was taught to put others first.
Under the nose. I get up in the morning and I put on a brave face.
I get up in the morning and I put on a brave face.
Under the chin. I pretend I'm okay.
I pretend I'm okay.
Collarbone. It's all a mask.
It's all a mask.
Under the arm. I push it down.
I push it down.
Top of the head. It's not safe to feel.
It's not safe to feel.
Okay, just take a slow, deep breath now. And I didn't ask you, Elena, at the start, when you tuned into that before, what was your SUD rating out of 10?
Probably about 7.
Okay. And now what I want you and everyone else to do too is to just reassess that. So just tune in again and just see how strong is the feelings, where you're feeling it, and if out of 10, where are you on that scale now?
It would probably be 3 or 4. It's definitely come down, but there's still a little bit there.
Yeah. And any thoughts or emotions or memories come up for you during that time?
Yeah, it's funny what comes up for me. It's less about work and more about my life as a mum.
Yeah.
It's really interesting. Yeah.
Yeah, good. Okay. So we're going to do another tapping round, which is a little bit more positive. We'll still talk about what we've done, but the idea is really that we do want to, before we change, we want to get it down to at least a 2. So it might be, if you can listen to this recording again, to just go back and redo it. And if you've got a few of your own words to say, then just say it. But we'll go ahead onto the more positive script and just see what happens. The other thing is, you may have noticed maybe some yawning, eyes watering, stomach rumbling, or any other sensations in your body. And these are all just signs that your nervous system is releasing really the energy. So did you have any of those symptoms at all?
Yeah, I felt like I wanted to yawn.
Yeah. Yeah, so just allow. Going to do the positive tapping script now. So once again, rate your level and see what it's come down to, and then we'll go into the points.
Okay. So the points, are they following this pattern of top of head, eyebrow, side of the eye, and with each point you say a different phrase? Is that correct?
Yeah, that's right. And it's not so like that is the proper routine to go through, but if you miss a point or want to stay on one for longer or anything like that, it's really not that much of a problem. You can do either hand, both hands, one side of the face, both sides of the face. It really doesn't matter. It's not that strict. So just go along. Remember where we've done it before. If you get stuck, just go. I'm not going to repeat the actual points this time, though. I'll just take us through the script.
Awesome. Yeah, let's do it.
Okay, great. All right. So I do an amazing job.
I do an amazing job.
I am a giver.
I am a giver.
I am a health professional.
I am a health professional.
And I'm proud of that.
And I'm proud of that.
With a big open heart.
With a big open heart.
Generous.
Generous.
I enjoy giving.
I enjoy giving.
It's what I know.
It's what I know.
I wear it like a badge of honour.
I wear it like a badge of honour.
I'm great at giving.
I'm great at giving.
I can't receive.
I can't receive.
I look after everyone else.
I look after everyone else.
But then I feel resentful.
But then I feel resentful.
But it's not up to them.
But it's not up to them.
It's up to me.
It's up to me.
The person I need to look after is me.
The person I need to look after is me.
I need to look after me.
I need to look after me.
I need some time for me.
I need some time for me.
I can't give from an empty cup.
I can't give from an empty cup.
I can't give when there's nothing left.
I can't give when there's nothing left.
When I'm exhausted.
When I'm exhausted.
I need to take responsibility for myself.
I need to take responsibility for myself.
And not blame others.
And not blame others.
I do have a choice.
I do have a choice.
I'm not a victim here.
I'm not a victim here.
Self-care or self-neglect.
Self-care or self-neglect.
It's really my choice.
It's really my choice.
I do deserve.
I do deserve.
To fill my cup and give from the overflow.
To fill my cup and give from the overflow.
I am taking responsibility.
I am taking responsibility.
I choose to feel good.
I choose to feel good.
I choose to feel great.
I choose to feel great.
It's better for me.
It's better for me.
It's better for everybody.
It's better for everybody.
I choose to take great care of myself.
I choose to take great care of myself.
It's time for me.
It's time for me.
I'm giving myself permission to take care of myself.
I'm giving myself permission to take care of myself.
It's time to tune into my body.
It's time to tune into my body.
And ask what it needs.
And ask what it needs.
I choose to give that to myself.
I choose to give that to myself.
It is non-negotiable.
It is non-negotiable.
I choose me.
I choose me.
Me first, so that I can burn bright and not burn out.
Me first, so I can burn bright and not burn out.
It starts with me.
It starts with me.
Just take a big deep breath. And so then once again, just rate. How do you feel? So just tune into your body, and what's the score out of 10 for you?
Oh, it'd be 1, probably closer to 0. That's a beautiful script. I love how nurturing it is.
Yeah, that's what I love, is the first one is always that more the pain points, the things that we're saying to ourselves and feeling that we don't often voice. And then the second one is again the same. We don't often voice it, but it starts to turn it around and what empowers us to make a different decision. So yeah.
Yeah, it's gorgeous. It's that self-compassion that I speak about a lot as well, offering ourselves and acknowledging that we need that.
Yeah, and acknowledging that we're feeling that. This script probably didn't have it so much, the feelings that we were feeling, but that's what it all is. It's just stating what's really going on for us.
Yeah, definitely.
So it can be really simple. This was long, and to do it for yourself, it certainly doesn't have to be that long. It can just be even just the one emotion that's going on, even though I feel this anxiety, even though I feel this anxiety, even though I feel this anxiety, that type of thing, or just this anxiety. So there's different ways to be able to do it.
Beautiful. So if people did that about the anxiety, and then would they say, like, I choose to love and accept myself or something afterwards?
Yeah, so you can do that way. You can do it as that setup as well. So that's that one when you start on the karate chop point. And so even though I feel this anxiety, I choose to love and accept myself, or I choose to feel better, or I choose to honour my feelings, any of those types of statements. As I said, if you want to explore this a bit further, there's so much on on Facebook, but probably on Google, you can just find so many things. And actually, I've got a screen that shares a little bit too. There's a free tapping EFT manual that you can download. We'll put all the links into the bottom here, so if anyone wants it. There's also a course that's great for health professionals and also educators. So it's called Evidence-Based EFT Training for Health Professionals, and it's through Dr. Peter Stapleton, who I've spoken about earlier. And it's a quick way for health professionals and educators to actually learn EFT and be able to use it, because they recognise that we already have so many skills that we're working with our patients, our students, and that we can transfer this into our work really easily. So that training is really great to be able to do. So the link will be there for that. Another thing that is great is Mind Heart Connect has a conference that is all for health professionals and using EFT, using mindfulness, other mind-body connection type of modalities, and with lots of research. And so that conference is going to be in Melbourne next year. It was in Gold Coast last year, so it's just once every second year. But that was a fantastic conference to go to. So you can subscribe to Mind Heart Connect if you want to know more about that. I think for nurses last year it was a 3-day event, and that was 20 CPD points. So yeah, it was a fabulous way to actually get some CPD, and I do use it in my work. I use it with patients who are going to theatre that are feeling really anxious, or waking up in the recovery room and feeling pain or distress. Then I do use it quite regularly, and I do use it with colleagues at work too. So yeah, it's really a great technique, as well as being able to do it for yourself. And it's fabulous for kids too. So with your kids, teach them, and you can look up on Google a lot of those sorts of things. So
that's awesome. Thanks for sharing that, Lauren. I'm going to check out both of them. And if I come to Melbourne, I get to catch up with you too, even better.
Absolutely. Yeah, come and stay. But yeah, it'll be it's a great conference. I'm actually disappointed it's not in Gold Coast. But
yeah, well, can't have everything.
That's right. Anyway, all right, beautiful.
Well, thank you so much for jumping on and sharing this with us today. As we said, this is going to be a video, and it's also going to be a podcast episode. So all these links and the downloadable PDFs will be either in the comments on all the social pages, or else they will be in the show notes on the podcast. So I hope you have found this as beneficial as I do. I'd love to hear your feedback. Let Lauren and I know what you think if you try it out, and we'll see you all again soon. Thanks for listening and watching.
Thank you.
Thank you for listening to the Happy Nurse podcast. If you've enjoyed today's content and would like to join the Happy Nurse community, head over to Facebook and check out the Happy Nurse AU Facebook page and request to join the Happy Nurse community. Also, check out happynurse.com.au for access to free downloads and subscription to my blog. See you soon, and in the meantime, remember to always offer yourself the same compassion that you so freely give to others. I'm excited to share with you all that I've contributed a chapter to the newly published Anxiety Relief Handbook. The handbook provides a unique window into 11 highly effective complementary therapies for you to sample on your quest to ease anxiety. The ebook is available on my website, happynurse.com.au/anxiety relief handbook.